Sickle cell anemia explained simply. A group of disorders that cause red blood cells to become misshapen and break down. With sickle cell disease, an inherited group of disorders. Red blood cells contort into a sickle shape. The cells die early, leaving a shortage of healthy red blood cells, sickle cell anemia, and can block blood flow causing pain, sickle cell crisis. Infections, pain and fatigue are symptoms of sickle cell disease. Treatments include medication, blood transfusions and rarely a bone marrow transplant. When your red blood cells aren't shaped right. What is sickle cell anemia? Sickle cell anemia is a genetic blood disorder. It affects the shape and function of red blood cells, the cells that carry oxygen throughout your body. Normally, red blood cells are round and flexible, like donuts without holes. But in sickle cell anemia, they become shaped like a sickle or crescent moon. These misshapen cells get stuck in blood vessels, break down easily, and can't carry oxygen well. It's inherited, meaning you're born with it if you receive the sickle cell gene from both parents. Why is sickle cell anemia a big deal? Sickle-shaped cells block blood flow causing pain, called sickle cell crises. Die early, leading to anemia, a shortage of red blood cells. Damage organs over time. Make people more prone to infections. Signs and symptoms. Requires a medical diagnosis. Infections, pain and fatigue are symptoms of sickle cell disease. People may experience pain areas in the bones or joints. Pain types can be sudden in the chest, whole body, dizziness, fatigue, low oxygen in the body or malaise. Also common, hemolytic anemia, developmental delays. Isosthenuria, jaundice, pale skin. Sausage digit or shortness of breath. Chronic fatigue or weakness. Severe pain in the chest, joints, or limbs, pain crises. Frequent infections. Swollen hands and feet in children. Delayed growth and puberty. Vision problems. Shortness of breath. Symptoms usually appear around 5 to 6 months of age. Complications to watch out for. Stroke. Acute chest syndrome, a medical emergency. Organ damage, especially spleen, kidney, liver, eyes. Leg ulcers. Gallstones. Priapism, prolonged, painful erection in males. Prevention and control. Since it's a genetic condition, we can't catch or cure it easily, but we can prevent, control, and manage it. 1. Prevention through genetic counseling. Know your genotype before marriage, AA, AS, SS. Couples with AS plus AS or AS plus SS. Combinations have a risk of having a child with sickle cell disease. Premarital screening is essential. 2. Newborn screening. Early diagnosis allows early care and fewer complications. In some countries, newborns are tested before symptoms appear. Management and treatment. Treatments include medication, blood transfusions and rarely a bone marrow transplant. There's no universal cure, but with good care, people with sickle cell can live full lives. 1. Medications. Folic acid for red blood cell production. Bone marrow needs folic acid and other vitamins to make new red blood cells. Ask your healthcare team about a folic acid supplement and other vitamins. Eat a variety of colorful fruits and vegetables as well as whole grains. Hydroxyurea reduces the number of crises and complications. Hydroxyurea, droxia, hydria. Daily hydroxyurea reduces the frequency of pain crises and might reduce the need for blood transfusions and hospital stays. But it can increase the risk of infections. Don't take the drug if you're pregnant. Pain relievers to manage crises. Your healthcare professional might prescribe narcotics to help relieve pain during sickle cell pain crises. Penicillin or vaccines to prevent infections. 2. Blood transfusions. Used during severe anemia, stroke, or surgery. Regular transfusions help prevent stroke in children. 3. Bone marrow stem cell transplant. Only known cure, rare and expensive. Mostly for children with a matched donor. Stem cell transplant. This also is known as a bone marrow transplant. The procedure involves replacing bone marrow affected by sickle cell anemia with bone marrow from a donor. The procedure usually uses a matched donor, such as a sibling who doesn't have sickle cell anemia. A stem cell transplant can cure sickle cell anemia. Stem cell transplant is recommended only for people, usually children, who have significant symptoms and complications of sickle cell anemia. The risks associated with the procedure are high and include death. Daily lifestyle and preventive tips. Drink plenty of water daily. Dehydration can increase your risk of a sickle cell pain crisis. Drink water throughout the day, aiming for about 8 glasses a day. Increase the amount of water that you drink if you exercise or spend time in a hot, dry climate. Avoid extreme temperatures, cold or heat. Exposure to extreme heat or cold can increase your risk of a sickle cell pain crisis. Exercise regularly, but don't overdo it. Ask your healthcare professional how much exercise is right for you. Reduce stress. Don't smoke. Smoking increases your risk of pain crises. Use medicine with caution. Use pain medicines such as ibuprofen, Advil, Motrin. Others, or naproxen sodium, are leave sparingly, if at all, because of the possible effect on the kidneys. Ask your healthcare professional before taking any medicine you can get without a prescription. Avoid infections, stay vaccinated. Eat healthy foods rich in vitamins and iron. Get regular medical checkups. Educate the public to reduce stigma. Living with sickle cell. People with sickle cell can go to school, work, start families, achieve goals with the right support, care, and knowledge. Genotype testing before marriage is key to stopping the spread. Early care and consistent treatment prevent complications. Talk about it. Share this message. Let's make sickle cell something we control, not something that controls us.
If you find this video helpful, like, subscribe or follow My Health by Dr. J for more important health videos.